So before we dive into the practical steps of managing ARFID, it's important to take a moment to reflect where you are right now at the start of this journey and how you feel towards change. Understanding your readiness to change is a crucial part of making progress. If you're resistant, it's important to identify that. If you're really motivated and really keen, let everyone know about it. So readiness to change refers to how prepared you feel and how able you feel to start making those changes to your eating habits. It's completely normal to feel unsure or even resistant about change, especially when it comes to something as deeply ingrained as your eating habits and ARFID. So change is always possible. Remind yourself of that every single day, and understanding where you are right now is a really good first step to understanding why you want to move forward. So without making changes, ARFID can impact your life in all the ways we've just discussed. So malnutrition, increased anxiety, stress, isolation. Okay, so now is time to really reflect on how we can make small, manageable changes to improve your relationship with food, reduce your anxiety, and help you feel more confident in social situations. I thought it would be important to really look at change, what that means, what that looks like. So you will have an image and a diagram of the stages of change. Everyone moves through these different stages when it comes to readiness for change. So the five stages, which can also be 5 changes, is pre-contemplation. So you might not feel ready to make changes or even recognize that your eating habits are a problem. I look at the stage as thinking about change. And then something could happen, more consequences could make you really contemplate change. So contemplation. So rather than thinking about thinking, you're thinking. You're aware that ARFID is affecting your life, but you're not sure if you're ready to take action just yet. So something that could be good is the next step, preparation. You've decided you want to make those changes and you're starting to gather that information. So that might be this part, joining the course, watching these videos. So then we're going to talk about actively taking steps to change your eating behaviors. So taking action, working to reduce your fears and anxiety around food. The most difficult part is the final and next and ongoing part of this process, which is maintaining the change. You've made progress and you're now focused on keeping those changes going. So wherever you are on this journey, that's okay. Have a think about where you might be about different elements of this journey. You might be ready to talk about it and taking action, but not ready to try foods. It's really important to take things at your own pace. To succeed in making these changes, what will really help you is noting whether you have committed to making the change. So commitment to trying new foods and following the steps of this course. Also looking at willingness to face discomfort. So how willing are you to make the change even when times are hard? Because every small step back is also a step forward, because you're always going to continue to progress. Support, as I've said, is super important from me, your friends, your family, your loved ones. Okay, you do not have to do this on your own. Please don't do this on your own. The ARFID Companion is designed to give you tools for cognitive restructuring, exposure therapy, anxiety management, which are all key for making these changes happen. But having someone to guide you can make a big difference. Having someone to support you can make a huge difference. Okay, so this course is going to give you an excellent foundation for managing ARFID, and sometimes having some support from someone else, from a therapist as well, can also help you tackle your unique challenges by making you accountable, checking in on you every single week. Okay, but also remember, it provides a safe space for you to explore deeper feelings about foods, fears, and anxieties. So if at any point you feel stuck, if you haven't done so already, make sure you have your free 30-minute phone call, and also maybe consider professional guidance and support. Okay, so I'd like to leave you with a few things to keep in mind. Commit to the process. Change will not happen overnight. Be patient. Follow the ARFID Companion. Wait a couple days before going from section to section. Let things kind of settle in. Give yourself time to try things at your own pace. Okay, So thank you so much, and I look forward to seeing how you get on for the rest of the course.